we've gone through the data on this very thoroughly. So both the ACE inhibitors and what we call ARBs, which inhibit the receptor, are drugs that we use for a variety of reasons, but most importantly for high blood pressure. Mm-hmm. And very careful studies have been done demonstrating that from what we see now, it's better to keep people on their ACE inhibitors and on their ARBs and maintain their pressures as correctly as possible. And that there was a fear at first that the ACE inhibitors and the ARBs might in some way contribute to there being more availability of receptors for the virus. Mm-hmm. But the studies do not show that. Certainly, like you said, there's a real risk for people who have high blood pressure, period, as one of the factors that we see contributing to a higher severity of disease. Well, there's a lot of question because there are salicylic acids involved with the binding of the virus to its receptor, right? So there's a lot of question about that, but hard and fast data really doesn't exist. There was one observational study in France. There was one observational study in France that suggested that one of these non-steroidal anti-inflammatories, specifically ibuprofen, may have led to worse disease in some individuals, and they speculated as to why that was. However, there's absolutely no hard evidence for that, and there's perfectly good reasons to consider a lot of these non-steroidal anti-inflammatories could do a lot of good. And there's certainly studies that at least one of them, indomethacin, does actually help people who have these severe acute respiratory syndromes that are caused by, in this case, COVID-19, the virus of COVID-19, SARS-CoV-2. So what's going on now throughout the country is we're looking at how cases are climbing or not in a particular community and what the predictions are. So as long as cases are climbing pretty high in a community, it's better to reserve the hospital beds and all the hospital equipment to manage the COVID patients when it's possible, and not do these elective surgeries. But we'll keep looking very carefully, and as the numbers go down, as we're able to take care of this, we should be able to open up the ability to do these relatively non-essential types of procedures that ultimately we all need for our best health.